Now, no matter what the cause, all of these guys are going to give us some signs and symptoms of respiratory distress. So how do you recognize trouble? Well, you might see an abnormal respiratory rate, right? So normal respirations are 30 to 60 breaths per minute. And it's normal to have periodic breathing or pauses that last up to 20 seconds. But if you start to see breathing that's over 60 breaths per minute or under 30 breaths per minute, or we have these long pauses in breathing that last over 20 seconds, then we're worried about respiratory distress. Next is abnormal breath sounds. If you see crackles on a baby that are persisting past the first few hours, we're concerned about respiratory distress. And of course, any decreased breath sounds, or these signs of increased work of breathing, grunting, nasal flaring, and retractions. So if a baby is breathing 80 a minute or has pauses in breathing that are over 20 seconds, what do you do? Well, we're going to stabilize with respiratory support. So we'll clear that airway, suction, give oxygen, and provide CPAP or ventilation. And we're going to treat the cause. So it's important to understand that infection, hypoglycemia, or cold stress can all increase that oxygen demand and worsen distress. So we want to make sure that we're preventing and treating any infection. We're monitoring for hypoglycemia and preventing cold stress by keeping that baby warm. We don't want to cause respiratory distress or make it worse. And of course, we'll treat our specific causes and give surfactant for respiratory distress syndrome. We'll suction for meconium aspiration syndrome, and we'll give supportive oxygen for TTN. And then we have our supportive care. We'll provide warmth to prevent cold stress, so maybe a radiant warmer or keeping them nice and swaddled. We'll gavage feed them to prevent aspiration. When babies are breathing really fast, they're at risk for aspiration. So you never want to PO feed a baby that's breathing fast. And we'll monitor their glucose for hypoglycemia and of course be monitoring their oxygen saturation. All right, time for your last NCLEX quick check. What are 3 signs of increased work of breathing? Well, that's going to be grunting, nasal flaring, and retractions. What kind of feedings should be given for a newborn with respiratory distress? Remember, we'll provide gavage feedings. We do not want to PO feed a baby that's breathing fast and risk aspiration.